Hello, I'm Professor Emily Mercuri, and this is Chapter 12, Integumentary System Medications in Essentials of Pharmacology for Health Professions, 9th edition. Chapter Objectives. Upon completion of this chapter, the learner should be able to describe proper application procedures for various skin medications, identify indications, side effects, and precautions or contraindications of the 9 major categories of skin medications, explain the factors that influence the absorption of skin medications, classify drugs according to their action, antipruritic, emollient, keratolytic, enzymatic, antifungal, anti-infective, or agents to treat burns and acne, identify appropriate indications of the 9 major categories of skin medications. Introduction. Integumentary system is the body's largest organ. It is the external covering of the body that serves to protect the inner organs from damages like abrasions, burns, dehydration, and ultraviolet UV rays. There are many conditions that can affect the skin, causing pain, annoyance, and discomfort. Skin ailments can range from itching to severe burns. Treatment is usually topical or local, but skin conditions are sometimes treated internally with oral medications or injections for systemic effects. So remember, local is just in one area, systemic affects the whole body. There are 9 major medication categories for the integumentary system. These include antipruritics, which relieve itching. Pruritus is the medical term for itching, so antipruritics against itching. Corticosteroids treat dermatological disorders. In general, steroids help to kick down the inflammation caused by the immune response. Emollients and protectants, which soothe irritation. Keratolytic agents loosen epithelial scales. Enzyme preparations promote the removal of necrotic or dead tissue. Scabicides and pediculicides treat scabies or lice. Local anti-infectives prevent and treat fungal and bacterial infections. Burn medications prevent or treat burn infections, and treatments for acne. Absorption of skin medications. Factors that influence the rate of absorption of topical medication include the time for the medication to remain on the skin. This is going to vary depending on which medication you're using. And then the type of the topical used affects absorption. So gels and creams are water-based. They tend to be absorbed more quickly. And then ointments and pastes are oil-based, and they're absorbed slower into the skin. Some ointments and pastes even sit on the surface of the skin and then get wiped off after minimal absorption has occurred. In addition, it's important to always review directions before administering. Knowledge check. Which instruction should be given to a patient with psoriasis who is prescribed a corticosteroid topical cream? A. The medication will be absorbed slowly. B. The medication will be absorbed quickly. C. Apply more cream if the skin starts to bleed. D. Wrap the area with a bandage after applying the cream. So let's talk through this. We know that creams do absorb more quickly, as we spoke about in the previous slide. So A would be incorrect. And then why would C and D be incorrect? So for C, we don't want to put creams or lotions or anything topical over bleeding open skin, ideally. There are some variations to that, especially with burns. But in general, we're not going to put a medication over open bleeding skin. And then D, wrap the area with a bandage after applying the cream. The cream is going to be absorbed really quickly. There's no need to wrap it with a bandage. Actually, the bandage could make the cream stay on the bandage instead of absorbing the way that we want it to. So the answer is B, the medication will be absorbed quickly. Case study activity. Barbara Smith seeks medical attention for plantar warts. During her appointment, she is prescribed a keratolytic. Remember that keratolytics are used for softening hardened skin, softening and can help exfoliate or pull off the top layer of skin. And the word lytic, it actually means dissolution, destruction. And so it is working by removing that top layer of skin, softening that, and letting the healthy tissue grow. So which teaching should be given to Barbara about this medication? A, use until the condition improves. B, avoid contact with surrounding tissue. C, cover the area after applying the medication. D, skin breakdown around the warts is expected. And the answer is B, avoid contact with surrounding tissue. So with keratolytics, we want to use them only right in the area where they're needed. And then the other answer that looked kind of tempting to me anyway, going through it, was discontinue use once the condition's improving. You don't want to discontinue use of this until the condition is completely gone, not just once it starts improving. So just remember, keratolytics, we want to only put them right on the area where they're needed. Antipruritic. The following details the use, side effects, and precautions or contraindications of antipruritic medications. Contraindications, remember contra, against, so not indicated. Use. Antipruritics are used short-term to relieve discomfort from dermatitis, which is skin irritation, inflammation, rashes, associated with allergic reactions, poison ivy, hives, and insect bites. They relieve itching by the use of products singly or in combination containing local anesthetics, drying agents, anti-inflammatory agents, and antihistamines. The side effects of antipruritics are stinging, burning, and allergic reactions to the medication itself. Precautions and contraindications. So these can cause delayed healing. We also don't want to use them on somebody who has issues with healing. Prolonged use is contraindicated. These are used short-term only. And hypersensitivity reactions. So if you have a reaction to it, you don't want to use it again. You're going to need to find a different medication to help solve the problem. The following images illustrate an allergic contact dermatitis reaction, A, and poison ivy, B. Both would be treated using an antipruritic medication. So contact dermatitis is typically from the skin coming into contact with something. A lot of times we see it with if someone washed their clothing with a new detergent that they had an allergy to and didn't know it. That's like a common thing that might cause contact dermatitis. And then poison ivy, you can see those welts look different, but both could be treated with an antipruritic. Corticosteroids. The following details the use, side effects, and precautions or contraindications of corticosteroid medications. The use is topically and systemically for allergic reaction conditions. Topically would be a lotion. Systemically, it can be given in many different ways, IV, IM, PO, even through an inhaler. The side effects of corticosteroids are epidermal thinning, so layer of the skin thinning, increased fragility of blood vessels, ulceration with occlusive dressings. So if we place a dressing over a corticosteroid, it can lead to ulceration of the skin breakdown, activation of latent infections, and slow healing. I mentioned it earlier, but corticosteroids kick down that inflammation, but they also, if there is an infection present, because they're kicking down that immune response, it can activate that latent infection. Latent means it's kind of like lying dormant in the body. And then slower healing, because again, the immune system is kicked down. And then precautions, contraindications, we don't use corticosteroids on open wounds. As you can imagine, with everything else we've talked about with corticosteroids, we don't want to impede the healing of the wound further. It sounds kind of strange when you hear it. Like, why would I be taking something that is going to suppress my immune response? But if you're having an allergic reaction to something, your body is having an inappropriate immune response. So you're reacting to this allergen in an inappropriate way where you're sending all this inflammation and all of these response to the area. So for example, like anaphylaxis, where the throat starts to swell if somebody eats a food they're allergic to. Right? We have to tell the body, don't do that. We have to kick down that inflammation. So we use corticosteroids when the benefit outweighs the risks, but they're not something we should be using all the time. The following images show psoriasis, A, and seborrheic dermatitis of the face, B. Both conditions would be treated using a corticosteroid medication. Both of these conditions are autoimmune, meaning that the body's responding inappropriately. The immune system is responding inappropriately, causing these flare-ups, and so corticosteroids would help to kick that inflammation down. Knowledge check. For which reason would a corticosteroid topical medication be contraindicated? A. Allergic to iodine. B. Patient is pregnant. C. Open wound on the skin. D. Taking a drug containing sulfa. C. Open wound on the skin.
Emollients and protectants. The following details the use of emollients and protectants. Use. Used topically to soothe, soften, protect via creation of a lipid barrier, and seal out wetness in minor dermatological conditions. Examples: diaper rash, irritation, abrasions, and minor burns. Think of something like Vaseline, so it's like a thick ointment that is covering the skin and creating a lipid barrier so that more moisture and liquid cannot get into the open and irritated area. Emollients and protectants are also used as first-line therapy in eczema and other conditions to reduce the need for corticosteroids or other medications. Keratolytic medications. The following details the use, side effects, and precautions or contraindications of keratolytic medications. Use. Used to control abnormal scaling such as dandruff, seborrhea, and psoriasis. Used to promote peeling of skin such as acne, hard corns, calluses, and warts. Side effects: irritation to eyes or mucous membranes, so you need to make sure you're not using them close to your eyes or mouth or nose. Photosensitivity. Precautions and contraindications: open areas of the skin. And photosensitivity, if you're not familiar, is a sensitivity of the skin to light. The following pictures illustrate a common wart, A, and a plantar wart, B, which is on the bottom of the foot, which would commonly be treated with keratolytic medications. Enzyme preparations. Bedridden patients are prone to decubitus ulcers, pressure sores, and diabetic patients are prone to develop foot ulcers. The following is important to ensure proper treatment and healing. So real quick, decubitus ulcers, also called pressure sores, that has to do with the skin being pressed up against something, creating pressure between the layers of the skin, which reduces blood flow. So the areas that these typically form are on bony prominences for someone who's laying in bed. So if you think about laying flat on your back in bed, the heels, the sacrum, even if they're turning side to side, the hip bones can be a bony prominence, an area that sticks out, the elbow. So we want to make sure we're protecting those areas for our patients. And then with diabetic patients, they're prone to develop those foot ulcers due to impaired circulation that's related to high glucose levels and then impaired healing as well. Necrotic skin, which is dead skin, must be removed in order to promote proper healing. Necrotic skin is typically black and hard, scaly kind of texture. Collagenase, also called Santel, is a topical enzyme ointment used for the chemical debridement, removal of dead or damaged tissue, of dermal ulcers and burns. So chemical debridement is something that kills that dead tissue via the use of enzymes. As you can imagine, that's very caustic to healthy tissue as well. So that can cause damage to healthy tissue as well. So we want to make sure that's localized to that dead necrotic tissue. Scabicides and pediculicides. The following details the use and treatments of scabicide and pediculicide medications. So scabies are caused by an itch mite that burrows under the skin. It leaves bites, typically in a linear pattern under the skin. Pediculosis, or lice, is caused by infestation of lice on the hairs of the scalp, pubic area, and trunk. And the treatments for these conditions are laundering or dry cleaning all clothing and bedding. Oftentimes they'll recommend doing a very hot wash and then also bagging things for a few days prior to washing and or after washing to make sure everything has, we've kind of suffocated the whatever is left on the sheets. Scabicides and pediculicides. The following images show a scabies skin infection, A, the scabies mite, B, and lice infested in hair, C. These are common conditions treated with scabicides and pediculicides. And if you are listening to this and you are sitting there itching now and scratching your skin and scratching your head, that's a very normal reaction to hearing about these things. Knowledge check. In which way would a topical gel medication be absorbed? A, slowly because it is an oil-based preparation. B, quickly because it is a water-based preparation. C, slowly because the site needs to be kept open to air. D, quickly because it is being applied to an area of calloused skin. Local anti-infectives. The following details the use and treatment of local anti-infective medications. These are used to treat diseases caused by microorganisms. Antifungals treat tinea, tinea pedis, which is athlete's foot, tinea corporis, which is ringworm, or tinea cruris, which is jock itch, as well as yeast, candidiasis, such as thrush, diaper rash, and vaginitis. Antivirals treat viruses such as herpes simplex, which is HSV, can cause cold sores and genital herpes. Herpes zoster, which is shingles, and varicella zoster, which is chickenpox. So this, because it's a local anti-infective, it would be placed on the open sores or the lesions caused from those things. Antibacterial agents treat bacteria such as impetigo caused by Staphylococcus aureus, some species of streptococci, and MRSA or MRSA, methicillin-resistant Staphylococcus aureus, as well as infected traumatic skin lesions. The images below show athlete's foot in A, body ringworm in B, and thrush of the tongue in C. These conditions would typically be treated with a local anti-infective medication. Again, A and B are both considered fungal medications, and then C over here is also considered fungal, but it's a yeast kind of infection. Antiseptics. The following details the use and treatments of antiseptic medications. These are substances that inhibit the growth of bacteria, frequently used to describe chemicals applied to body tissues, especially the skin. Major antiseptics in use today are chlorhexidine and povidone iodine or betadine, which are used for surgical scrubs and as bacteriostatic skin cleansers, meaning if we're going to do an invasive procedure such as insert a central line into somebody, insert a Foley catheter, we're going to, or do a surgery where we're going to be actually cutting into the skin, we're going to use an antiseptic to make sure that we inhibit growth of bacteria in that area. Knowledge check. Which topical agent is used to promote peeling of the skin? A, antiseptic, B, antifungal, C, keratolytic, D, pediculicide. And the answer is C, keratolytic. Burn medications. Burns are injuries to the skin and tissue below the skin that are caused by heat from flames, hot liquids, steam, heated objects, chemicals, friction, electricity, radiation, or the sun. There are different levels of severity, including first degree, which is superficial, second degree, which is partial thickness, and third degree, which is full thickness. The images to the right here illustrate the various degrees. So A is a first degree. It's showing like a basic sunburn with no blistering. B is a second degree. You can see there that there are large blisters. This has gone into a partial thickness. It's invaded the next layer of skin. And then C and D are both third degree. There is an opening to the skin. It's going down through multiple layers of the skin. Those are more severe burns. Topical burn medications are used to prevent infection, reduce pain, and promote healing in burns. The choice of medication depends on the type and severity of the burn. Below are some common types and their specific uses. Antimicrobial ointments and creams. These are used to keep burns free from bacteria and infection. Some common examples are silver sulfadiazine and mafenide acetate. Pain relief medications. These are used to relieve discomfort and itching from burns. Common examples are lidocaine or benzocaine gels, which kind of numb the area. And there are also special dressings such as hydrogel or silver impregnated dressings that help promote wound healing. Sunscreens. The following details the use and treatments of sunscreen medications. Overexposure to the sun is considered to be the primary cause of skin cancer. Skin cancer is the most common form of all cancers in the United States. Just something to be aware of is that skin cancer can also affect anybody. It does not matter your skin tone. It's a common misconception that only people with very light skin can get skin cancer or people that burn easily. It is true that severe burns increase your chance exponentially of getting skin cancer as well as family history, but it can happen to anybody. So actually everybody should be protecting with sunscreen. Something I'm very passionate about because actually everybody in my immediate family has had some sort of skin cancer removed at this point, other than me. I'm biding my time here, but something to be aware of. I just want to make sure you all are protecting yourselves out there. UV radiation is a type of invisible light emitted by the sun, and this is divided into two types, UVA and UVB. So sunscreen sun protection factor is a measure of the protection the sunscreen offers. Greater than 30 reduces the risk of skin cancer. That being said, you will see sunscreens up to SPF 100. It has been shown that it is not really more effective to have 100 versus like the 60, 70, 80. It's very minimally different. So you don't necessarily need to go up to 100, but greater than 30 is required for reduction in the risk of skin cancer. Agents used to treat acne. The following details the use and treatments of acne medications. Acne is a common condition of the skin. It affects almost everyone to some degree. Acne is most commonly seen on the face, scalp, neck, chest, back, and shoulders. Mild acne may be treated with non-prescription topical medications. However, if someone has severe acne, it may be treated with a combination of a retinoid and a topical antibiotic or oral antibiotic. Knowledge check. For which skin condition would a topical enzyme preparation be prescribed? A. Remove necrotic tissue. B. Soften minor skin irritations. C. Treat herpes simplex lesion. D. Kill bacteria in an infected skin wound. The answer is A. Remove necrotic tissue. Mechanism of action and indications for use. This is just a handy table here detailing all of the types of medication and what their indications for use are. So again, we'll talk about antipruritics, use relieve itching caused by topical allergic reactions and insect bites. Corticosteroids treat allergic reactions, psoriasis, and seborrheic dermatitis. Emollients and protectants treat diaper rash, irritation, abrasions, and minor burns. Keratolytic agents control abnormal skin scaling or promote skin peeling. Enzymes debride dead tissue from ulcers and burns. Scabicides and pediculicides. Scabicides treat scabies, pediculicides treat lice. Anti-infectives treat fungal, viral, or bacterial skin infections. Antiseptics inhibit bacterial growth on the skin. Burn medications prevent or treat infections from damaged skin. Sunscreen prevents damage from UVA and UVB. An acne medication treats blemishes on the face, scalp, neck, chest, back, and shoulders. Self-assessment. For which conditions would a topical anesthetic be used? What factors influence the absorption of skin medications? Describe the proper application procedures for various skin medications. This has been Chapter 12 in Essentials of Pharmacology for Health Professions, 9th edition. Thanks for listening.